It is said that the eyes are the gateway to the soul. When we make eye contact with another person, we're really making a subconscious assessment of their degree of restedness, state of mind, and attractiveness. As we age, the eye starts to show telltale signs such as prominent fat pads in lower and upper eyelids, wrinkles, and a tear trough deformity or nasojugal groove. Assessment of brow aesthetics should also be included in any blepharoplasty consultation, as a drooping brow can often exacerbate upper eyelid aging changes through the lateral hooding it creates. Several characteristic changes occur with the aging process. The tissues around the eye are unique in the face in that the orbicularis oculi muscle is situated directly under the skin with nothing in between. The muscle is free-floating, only directly anchored to the facial skeleton in a tiny area. Under this muscle layer, the ligaments and membranes that retain this muscle in place and contain the orbital fat within the orbit can be seen. 3 distinct fat pockets are present in the lower eyelid. These can bulge forward and become increasingly prominent with age, causing the appearance of eye bags. For patients, a stealthy yet effective method of improving eyelid aesthetics is transconjunctival laser blepharoplasty. This uses a carbon dioxide laser to remove fat from the lower lid fat pockets by making an incision from within the lower eyelid conjunctiva, as shown. This incision heals rapidly on its own. The external skin is then resurfaced to tighten it up using the laser scanner, and the patient has usually healed within 10 days. This procedure offers a very safe approach with less than half the standard recovery time associated with conventional blepharoplasty. If the upper eyelid is the main problem, then this may be addressed alone by removing a scimitar-shaped piece of skin together with underlying orbicularis oculi muscle, not the muscle that raises the eyelid, and occasionally some of the underlying fat. This is sutured closed and can help to increase definition of the upper eyelid skin crease and reduce hooding. With advancing age, the orbital fat herniates forwards, causing a bag, and as the cheek fat, suborbicularis oculi fat or SOOF, descends simultaneously, a hollow appears between them which is known as the tear trough. When there are significant aging changes and both upper and lower eyelids are drooping, simultaneous upper and lower eyelid blepharoplasty combined with a canthopexy may be performed. An upper eyelid incision enables not only removal of excess skin, muscle and fat, but also provides access for re-anchorage of the lower eyelid soft tissues to the lateral orbital rim in a surgical maneuver known as canthopexy. The lower eyelid is then approached through an incision just beneath the lashes. This incision is then deepened through the orbicularis oculi muscle, and the orbicularis retaining ligament is freed. The orbital septum, the membrane which retains fat within the orbit, is exposed, including its bony attachment to the lower orbital rim, which is known as the arcus